When studying for big exams like the MCAT, it's important to just keep breathing. But have you ever wondered how you breathe? Well, that's what this lecture is going to be about. In the lecture 6, we're going to go into the respiratory system. Starting first with the anatomy and mechanism of breathing. Breathing relies on negative pressure gradients, which is controlled by the diaphragm. As the diaphragm contracts, it's going to expand the chest and rib cage. This expansion is going to create a negative pressure gradient, pushing air into your lungs. When you exhale, the diaphragm is going to relax, shrinking the size of your rib cage and pushing air out. When we look at airflow, it goes through a variety of structures, and obviously there's a bunch of intermediates, but the main 5 we're going to go into are going from the mouth to the pharynx, to the larynx, to the trachea, and lastly into the alveoli. As I stated earlier, breathing is undergone using a negative pressure gradient, and it's controlled by chemoreceptors and blood gas concentrations. If you are experiencing low oxygen in your blood, you're obviously going to increase your respiratory rate, and the opposite is true. When we're talking about alveoli, these are small sacs in the lungs that diffuse gas with pulmonary capillaries. Surfactant reduces the surface tension to prevent the collapse of your lungs. Obviously, if your lungs collapse, you're going to have a hard time breathing, so surfactant helps to prevent this. The diaphragm is the muscle that helps to create these pressure differences for breathing. Damage or malfunction to this muscle is obviously going to create some serious problems when it comes to respiration. When measuring respiration, we use a spirometer. This measures lung capacities and volumes, and there's a couple values. The total lung capacity is the max volume of air that the lungs can take in during a full inhalation. The residual volume is the minimum volume of air in the lungs after a full exhalation. Because we don't want the lung to collapse entirely, we want to ensure that there is some air still in the lungs to maintain some of its shape. The vital capacity is the difference between the minimum and maximum air volumes, and the tidal volume is the volume of air inhaled and exhaled in one breath. The expiratory reserve volume is the additional air that can be pushed out after a normal exhalation. If you want to try this, exhale normally and continue pushing until you can feel strain in your chest. Obviously don't try too hard though, but this is more or less what the expiratory reserve volume is. The inspiratory reserve volume is the additional air that can be taken in after one normal inhalation. If you've ever practiced meditation, you're going to be very familiar with what an IRV looks like. Now that we've gone over the anatomy and functions of the respiratory system, let's go more into the functions of it. The pulmonary arteries go to the lungs. As it states in the name, arteries travel away from the heart. But for rest of the body, arteries carry oxygenated blood. For the pulmonary artery, however, it carries deoxygenated blood from the heart to the lungs to get oxygen back and to expulse high concentrations of carbon dioxide. The pulmonary veins carry blood away from the lungs and to the heart. This carries oxygenated blood with a low carbon dioxide concentration. There are a couple other functions when we talk about the respiratory system. The mucus and immune cells in the lungs defend it from pathogens. Obviously, we're taking in a substantial amount of air every day, and having our immune system compromised from pathogens we take in is obviously very dangerous. This is where our mucus and immune cells come into play. In addition to this, the respiratory system regulates pH via the bicarbonate buffer system. If pH decreases, respiration will increase. This is to blow off carbon dioxide and to reduce hydrogen concentration. And if pH increases, respiration will decrease to trap carbon dioxide to increase and sustain hydrogen concentrations. If you're unfamiliar with the bicarbonate buffer system, it simply states that when we're carrying CO2 in our bloodstream, we're going to transfer it to carbonic acid. Because of this, excess CO2 is going to increase your acidity. Alright, so like I said earlier, make sure you keep breathing, relax, and continue studying hard. And please join us in the next lecture as we go into the cardiovascular system.